Good evening, everybody. Myself, Dr. Kumar Rajiv. I am an interventional cardiologist working in the Navi, Mumbai. I am attached to Fortis Hospital, Reliance Hospital, and I have my own clinic, S2S Cardiac Center in Sanpad. Yeah, heart failure is a condition where heart is not able to pump the adequate blood into the circulations, leading to the decreased oxygenation of peripheral organs. So when we have this condition, the peripheral organs we have conditions like the kidney, we have a liver, the different organs is not able to get the adequate oxygenation, and then it starts showing their malfunctions. And if you see the incidence wise, the incidence among the India is around 1 to 2%. And we have to be very careful about this disease because it's a very common, and the patients are suffering a lot in the absence of adequate treatment. Yeah, see, most of the time there is a multiple risk factor which is responsible for the causing of ischemic heart disease, and that finally land up a person into the heart failure like conditions. In these risk factor, the patients who are having diabetes, who are having long-standing hypertension, which is uncontrolled, patient who has got a high cholesterol level, then finally leads to the atherosclerosis, and then they have suffered in a heart attack-like situation, leading to the decreased pumping action. The patient who are chronic smokers, again, they can have a ischemic heart disease predisposition. The patient that are chronic alcoholic, they can develop the conditions like the dilated cardiomyopathy, where the heart pumping is very low, and then the patient can develop these kind of heart failure like conditions. So there are the multiple risk factors, but in the clinical practice we do see patients who doesn't have any risk factor in the past, and they have suffered from the dilated cardiomyopathy, they have suffered from the ischemic heart disease, and finally landed up into the heart failure like condition. Yeah, heart failure in today's era is very easy to diagnose. The problem happens because of delayed presentation by the patients. General education regarding the health education is plays a very important role over here. There are sometimes certain symptoms which are related to heart failure. Those are very common symptoms. If any person who has got these symptoms, like breathlessness on exertion, if they are feeling which is very unusual, easy fatiguity if they are getting, if the patient has got a leg swelling, patient is getting palpitations, patient is feeling that they have a recent gain in their weight, patient has got an exertional angina, or you say the chest pain, whenever they are walking they are getting chest pain. So these are the common symptoms. If any person has got these kind of symptoms, they should be very careful, and they should contact their doctors as early as possible. And the diagnosis is very easily based upon their symptoms. The doctor will ask certain investigations that include some blood investigation, ECG, echocardiography, and most of the time the echocardiography gives us a clear-cut picture about the heart failure-like conditions. And in echocardiography, we measure the heart pumping ability, efficiency of the heart pumping ability. Normal person has got efficiency around 50 to 60%. If your efficiency goes down less than 40%, there are very high chances that you are likely to develop heart failure. On the top, if you have symptoms related to the heart failure, and then you have an echocardiography which is suggestive, then the diagnosis is almost made over there. And as far as the treatment is, we have today's n number of medicines where we can treat our patients very safely, very comfortably. Patients has to come for the regular checkup. They require to do certain investigations. Medications we have mainly related to the heart failure, which improves your pumping. It can help you in improving your blood supply. It gives you a very good life. Some medicines are diuretics, where we have to pass excess urine to decrease the load on the heart. There are some medicines which help in controlling the heart rate. So we have a very good medicines, we have a good investigations tools to improve the patient's life patient's overall well-being. Yeah, one thing is very important: education. Education is very important for the patients. We do see that the patients are very elderly patients. They are not able to take care of themselves. So they are a family member who are giving the medicines. They are not there all the time. So patient education is, I think, is very important over here. Right from their diet, right from their disciplined lifestyle, taking medicines on a very particular time, fluid amount, whatever has been told by the doctor, they have to follow very regularly, and a regular visit to their doctors. Their scheduled visits will be there for the doctors. On the top, if you get any additional symptom or any new symptoms during the course and your visit is not due, then you should visit to your doctor and try to find out whether the things are related to your heart failure or not. If you follow these simple things, then definitely you will have a better quality of life. Your hospitalizations due to related to the heart failure will definitely come down, and then you can lead a normal day-to-day life. Yeah, see, the good lifestyle is very important, not only for the heart failure patients, but for the patients who are living a normal life also and who have not suffered from the heart failure. If you want to keep your heart stronger, regular exercise, good amount of walking, at least 1 or 2 kilometer walking every day. You have to restrict your fluid intake if you have a heart failure. Depends upon what is your heart efficiency, working efficiency. It can be somewhere from 1 liters to 1.5 liters. That includes everything you drink in your day-to-day life in 24 hours. It has to be very restricted. If you should have a weighing machine at home where you can check your weight, if possible, every day. So slight change in the weight also should alarm you to that something is going wrong, because here the water starts accumulating in your body. By the time you develop symptoms related to heart failure, already 2-3 liters water has been locked in. So if you keep a check on your body weight every day, you will be able to come to know. Taking the vital parameters at home is also play a very important role in the heart failure patient. Like you can nowadays we have a very good machines which is available, which can check your blood pressure, which can give an idea about your pulse rate, which will give idea about the oxygen saturation level. So these things everybody should have at their home if they are suffering from the heart failure, because a lot of the medications what we give to the patients, they also have an impact on the patient's blood pressure and the heart rate. So if you can monitor these things, then you will be yourself will be able to judge which medicine is causing low blood pressure, which medicine is causing decrease in the heart rate, and then you will be in the better positions to adjust the dose of these medicines. Otherwise, if you go to the doctor and then for the 3 months you are on the same dose, titration is not possible just because you are going to the doctor for once in a week or once in a month. So if you have all these gadgets at your home, then definitely it will improve your heart failure well-being. Apart from this, if you have a heart failure, try to take your medicines very regularly, very stringent. You should be having about your diet, you should be having about the medications timing, and your follow-up. All these things has to be done. By doing all these things, you can keep your heart healthy, or at least maintain at a level which can support your body to do your routine activity. That's how you can maintain a good heart or a good overall well-being for a heart failure patient.